BiomedRx Optimum Woman is the only woman's high-potency full-spectrum multiple vitamin supplement to contain 56 nutrients, including those most important for today's woman, such as calcium for bone health, iron for healthy red blood cells, beta-carotene, biotin for nail and hair health, gamma-linoleic acid from evening primrose oil, octasanol, grapeseed extract, a potent antioxidant important for maintaining capillary strength, and vegetarian digestive enzymes. Visit www.biomedrxsupplements.com.
Gold label quality BiomedRx CBD oil is made from organic hemp that is locally grown, glyphosate-free, gluten-free, non-GMO, homogenized, third-party tested, and CO2 extracted. Visit www.biomedrxcbd.com.
Hi, this is Devin Lockett, the president of JobSite Route. As the son of a general contractor, I know how difficult it can be to get good food on the job site. And letting your construction workers leave the job site to buy lunch just takes valuable time away from them being on the site. I've developed an app and a program that will bring a steady stream of food trucks to your job sites every month for the low price of only $100 per month per site. That comes up to about $3 per day to have a steady stream of food trucks coming to your job sites all day, every working day. You can also contact the food trucks ahead of time and pre-order your food from the menu on our app. This saves valuable time for your construction workers and for you. It also sends a variety of delicious food served on Southern California food trucks to your job sites all day. When you think about it, it only makes sense to join the JobSite Route Network. All right. Let's see if we can do this without technical difficulties this time. Thank you for sticking with me. Very sorry about the last take, the last try. The microphone didn't seem to be configured properly. Thank you for joining me. Happy Friday, happy Friday, happy Friday. Friday is my favorite day of the week, as everyone knows. And today we are going to discuss bipolar disorder. I'm sure everyone knows at least one person that they can describe as bipolar, someone who has unpredictable emotional or an unstable emotional state, or who is likely to go off, quote unquote, or is likely to act very angrily or act in an emotionally inappropriate manner at any particular time. And just like we don't judge people for self-medicating with alcohol or drugs, marijuana is legal here in California. And the BioMedRx Health Center is, in essence, a head shop. So we don't judge. We don't judge people for self-medicating. And at the same time, we try not to judge people for having emotional instabilities, right? Bipolar disorder is a state of emotional instability. Bruxism, anorexia and bulimia, depression, anxiety, stress. These are all emotional instabilities. So we don't judge. We try to deal with people where they are so we can work with them to get to a better place. Now, as I said before, the BioMedRx Health Center is a head shop, right? In every sense of the word. The primary therapies that we do are neurofeedback, cranial electrotherapy stimulation, audio-visual brain entrainment, hypnotherapy, binaural beats, the gateway process, and lots of different ways of training the brain. And of course, when you're dealing with someone that has bipolar disorder, the first thing you would think is that this person primarily needs some work done on his or her brain, his or her head. Yes, normally when a person has bipolar disorder, that person's neocortex is severely dysregulated. But there are other conditions that may lead to the state of bipolar disorder, many of them having to do with the body and imbalances in the pH due to the presence of pathogens. Pathogens being viri, bacteria, fungi, parasites, and even heavy metal burdens. Now, we're going to show you how to use a very few pair of magnets to augment whatever training you or your client, patient, may be undergoing right now to address bipolar disorder. In other words, I'm not going to show you the neurofeedback. There are a lot of neurofeedback videos on this channel and on my Devin Lockett channels that show you how we address bipolar disorder directly with the brain. And I am going to discuss that. If we were to take a neurofeedback or a neurotherapeutic approach to bipolar disorder, I would train the person T3 to T4. This is your temporal lobe 3 to T4. This trains straight across the brain, straight across all three cortices of the brain, and we get to train the brain stem and your lizard brain, which is the repository or which is the center of the angst that makes a person unstable, that cures instabilities. So once we can balance the hemispheres of the brain using biomagnetic pair therapy, we can get to calm the instabilities. If a person has an abundance of traumatic memories or enmeshment or a history of emotional abuse as a child, we would also train T4 to P4, the parietal lobe, doing infralow neurofeedback, and we can get rid of a lot of the tightness, the dysregulation in the neocortex that is the type of PTSD that we accumulate in normal life, right? By applying the ear clips of cranial electrotherapy stimulation from the Mind Alive devices, you can find out more about them at mindalive.com. We can stimulate the brain to produce norepinephrine, epinephrine, and most importantly, serotonin,
right, in perfect balance. And this will also help a person stabilize and not be so bipolar, right? But none of those therapies are what we're talking about right now. Right now, I'm only going to address bipolar disorder using biomagnetic pair therapy. A couple of more words I want to add. One, yes, we do not judge, and we are accepting, and we understand that this is a head shop and that people self-medicate, and that some people tend to drink alcohol and some people tend to smoke marijuana and do other things to self-medicate. We don't judge you, but we're trying to work you into a place where you do not have to rely on drugs and or alcohol to reach a state of balance in your life, to reach a state of happiness and peace. And then ultimately you reach the point of going beyond just not being in mental or emotional distress to actually constructively and positively moving your mind, your brain, and your body, your entire person to a state of peak cognitive and physical performance. I used to say peak mental performance, but mental kind of brings in the whole emotional thing and whatever. And I can't make an assumption on what a person's emotional base is. I deal with a lot of veterans that come back from war in Afghanistan and Iraq. You can see my videos here about PTSD. And I deal with a lot of civilians who have never been exposed to combat. So I don't know where you're coming from, but all I know is I can help you get to a better place than where you are. And that's what we're trying to do here at the BiomedRx Health Center. Like I said, I don't expect you to have access to an electroencephalograph. I don't expect you to have access to the Mind Alive David Delight Pro or the Mind Alive David Alert Pro or any of our other brain entrainment devices. I don't expect you to be a trained hypnotherapist, but what I will do is teach you the basic locations of where to place magnets if you're dealing with a person who has bipolar disorder. Now remember, when you're placing magnets for biomagnetic pair therapy, I've taught in just about all of the other videos how to do the muscle testing, right? Because the heart is primarily on the left side of the body. The left hemisphere of the brain gets more blood than the right hemisphere and therefore is larger and more pronounced in just about everyone. And therefore, the critical faculty resides on the left. The subconscious resides on the right hemisphere. The left hemisphere controls the right side of the body. The right hemisphere controls the left side of the body. As we find a pathogen with the negative pole of a magnet, increasing the circulation and the pH of the section, the place where we have the negative pole of the magnet. If the body does have a pathogen, meaning virus, bacteria, fungus, or parasite, then the body's going to respond with tension. The only thing muscles can do is flex and relax, and therefore the longest muscle bellies in your body, which are on the femur, are going to flex and tense up at the moment we find these pathogens. Because of this, the dominant hemisphere, your left hemisphere, is going to instruct your right leg to tense up a little bit more than the left, and therefore a very minute difference in the lengths of your legs are going to appear if you're looking at the bottoms of your heels. And this is called the muscle testing diagnostic procedure for biomagnetic pair therapy. So place the negative magnet where it goes first, then look at the feet, and then if there is a difference, then you know you've hit a pair that needs attention, a pair of locations that needs attention, and then you place the positive magnet where it goes and see if the heels of the feet even out. And if that's the case, then you're bingo on that one location. So we don't have too many pairs that deal with bipolar disorder, so this is going to be an incredibly long video, but I look damn good in my suit, so I might as well make it a good video, even if it's not going to be a long video. So let's go to the next slide, and I'm going to show you the locations for bipolar disorder, or as we say in Spanish, bipolaridad. Let's get to here first. All right, and transfer. All right. Here we are again. Now, here is our chart. And as you can see, there are very, very few pairs for bipolarity. So that's good. We're gonna go over them. The first pair was anus to lumbar vertebrae number 5, with the negative on the anus and the positive on lumbar number 5. Okay. The second pair, eyebrow to eyebrow, ceja to ceja. The third pair, your ECM right here to your thymus, the positive on the thymus. A note about the thymus gland. The thymus gland is a repository for the E. coli bacteria. So E. coli, being a bacteria, will raise the pH of the thymus gland, and by putting the positive pole of a magnet on the thymus gland, you can lower the pH. Occipital to occipital, right there across the occipital lobe. Remember, most of the dysregulation that we accumulate from people working on our nerves, we're going to accumulate in the back of the brain, the parietal lobe and the occipital lobe. Okay, valvula, iliac valve, and the stomach. Okay, and I'm sure I'm pronouncing this wrong, so doctors, correct me in my translation from Spanish to English in the comments below, right? All right, and the last pair would be right in the navel, where I normally place my unipolar negative magnet, and on the left earlobe, where I have placed my earrings. So now you see, okay, this is the area. These are the places that we're going to be placing magnets to address bipolarity or bipolar disorder, or getting pissed when you're not supposed to get pissed, or an uncontrollable temper. You know, these instabilities usually accompany character issues as well, like narcissism, Machiavellianism, and psychopathy. And like I said, I'm an understanding person. This is a brain shop. I work primarily on the human brain and the human mind and the human psyche. I'm very, very understanding and non-judgmental when it comes to accepting people's decisions to self-medicate. However, don't be coming up in my face with no bullshit, because I'm not going to tolerate someone who is bipolar and doesn't know how to appreciate and respect the therapist that is actually helping them to reach a better place. So I do have to establish boundaries, even though I am understanding, and even though I do know that a person who is living with a severe amount of neocortical dysregulation is suffering, and they're in pain, and they're not doing very well. So we can make allowances for someone, you know, being in a state of dysregulation and all of that. But at the same time, if you come here to the BiomedRx Health Center, please have your respect in check, all right? Or I will check you. And here goes. I'm going to show you the locations using my son Kai as a model to address bipolarity. So, let me open up our rastreo. Bipolarity, all right, as you've seen before, all right, so. lumbar. All right? Pick up your butt, son. Pick up your butt, son. Right, negative under the anus and positive under lumbar number 5. Right about there. Right about there. Put your butt down. All right? And you don't want to use the really powerful ones on children. But my child is bigger than me now, so I'm not worried about that. ECM to the thymus. Now, perhaps on the ECM, I'll put a teardrop magnet. Oh no, I'll put this round magnet here. And then on the thymus gland, I will use a powerful magnet. So the thymus gland gives a powerful positive, and then the ECM on the right hand, right side of the neck, we'll put this negative. Right there. Hold the ECM magnet in place with a little tape, and hold the positive in place with a clip. Oops. Sorry, son. All right? Occipital to occipital. Now this is a very important pair because it is on his head, and the occipital lobe as well as the parietal lobe are places on the head that accumulate a considerable amount of neocortical dysregulation while experiencing the vicissitudes of life, right? When you're going through the BS that you go through in life, the emotional turmoils and tribulations and trials that you have to go through in life. In other words, people literally work on your nerves. Yes, they do. You were not imagining things. So we put the negative and the positive right here on the occipital lobe at the back of the head. Okay? Parietal lobe, occipital lobe. The iliac valve and the stomach, the estómago. Okay? The estómago. I like to repeat words in Spanish for no reason. You can ask my son, he'll tell you that. So, the iliac valve, negative, right here, the negative, right here, and the positive on the estómago, the stomach, right? The last pair would be general, the navel, right, as well as the right earlobe. Well, you know me, and if I'm going to treat the navel, I always reserve my big unipolar negative magnet right on the navel because it releases stem cells, right? And then I'm going to find something a little bit more a little bit more polite, if you will, right? Took place on his left. That's the left ear, yeah. On his left earlobe, right? So we do that with a little bit of tape. Now, my guest reference is sharing with me. But I'm going to share with you another pair that you can use that helps with bipolar people. And that is on the right templar lobe. Okay? The right templar lobe, the right templar lobe is a place that we have a lot of success helping people who are criminally insane or who have violent tendencies or who are just simply emotionally unstable. A lot of times when you're dealing with people in prison, when you're dealing with people who have emotional problems, we can calm the emotional center, the right lobe, the right temporal lobe of the brain with negative and positive.
Even superheroes and supermodels need a daily dose of nutrients to help make life more super. BiomedRx supplements is making it easy to get exactly what you need. From kids to seniors, they've got something for everyone. Pretty cool, right?
The pairs that we have here,
Check out their products at BiomedRxSupplements.com.
That cells tend to stack up on top of each other or into chains in order to protect each other, and this prevents the proper flow of blood. It prevents the proper operation of your leukocytes, of your white blood cells, and it prevents you from fighting bacteria, fungus, parasites, heavy metals, and it creates pockets, what we call reservoirs of acidity and alkalinity, which make it easier for you to suffer from other pathogens and illnesses. So what biomagnetic pair therapy does, if you are well hydrated, it is a great way to augment other medications and other treatments that are suggested by your doctor to help your body to discharge pathogens, to detoxify itself, help assist the body's own immune system in doing its job and helping to rid your body of these pathogens. Right? So at this distance from the equator, we're going to leave the magnets in place for 30 minutes and take them off. And then make sure your client drinks a lot of water and that you, as a practitioner, drink a lot of water when performing biomagnetic pair therapy. Well, thank you for watching. Thank you for joining me, and thank you for putting up with this. Like I said, I wish I had more pairs to show you, but then again, I kind of don't wish I had more pairs to show you because dealing with bipolarity or bipolar disorder is relatively straightforward. There are very few pairs of magnets. I gave you an extra pair, which are the negative and positive to calm the right hemisphere or the right templar lobe. And yeah, that's about it. And of course, if you were here at the BiomedRx Health Center, I would treat you with neurofeedback. I thoroughly believe that the neurofeedback training, as well as hypnotherapy, would be probably the greatest contributor to your success in therapy here at the Biometrics Health Center. So that's about it. I'm gonna go and enjoy my Friday and enjoy the weekend. Probably gonna go live from the beach tomorrow, something like that. Give you guys a taste of, Kai and I out in the sun. I want you guys to stay kind. As you know, kind is not only the new sexy, kind is the only damn sexy. I don't want to hear anything else. I want you to stay blessed, and I want you to stay healthy, right? Be good to people, and make good things happen, okay? I don't do this for money. I do this to help people. I do this to find other people who are in a similar situation as myself, who want to get the most out of life, and I help them to do that. So if you like what I'm doing, if you appreciate what I'm doing here, please hit us up on Cash App, right? Cash App, BiomedRx, $BiomedRx. You could also join us on Patreon, BiomedRx TV. That's patreon.com/BiomedRx TV, or patreon.com/Devin Lockett. Be sure to subscribe to all three of the Devin Lockett channels: Devin Lockett Voodoo Child, and Devin Lockett Reactions, as well as BiomedRx TV and Kai Lockett here on YouTube. Yeah, that's about it. If you want me to discuss any particular illnesses or any particular therapies, feel free to mention it in the comments below, or contact me at info@biomedrx.tv. And if you want me to demonstrate, if you'd like me to demonstrate your products, contact me at info@biomedrx.tv, and or mail the product to me to check out, to evaluate at 8306 Wilshire Blvd, Suite 777, Beverly Hills, California, 90211. That's the address of BiomedRx TV. All of that's going to be seen on the credits that you're going to see right here at the end of this video. So I hope this was helpful. Go ahead and save this video, bookmark it, and you can always back up if you have someone in your family suffering from bipolar disorder. And now you know the very few but very effective places to place magnets to heal with. All right, so I hope you guys have a wonderful weekend, and I will see you on the next live. Peace.
Gold label quality BiomedRx CBD oil is made from organic hemp that is locally grown, glyphosate-free, gluten-free, non-GMO, homogenized, third-party tested, and CO2 extracted. Visit www.biomedrxcbd.com.
Biomedric's Optimum Woman is the only woman's high-potency full-spectrum multiple vitamin supplement to contain 56 nutrients, including those most important for today's woman, such as calcium for bone health, iron for healthy red blood cells, beta-carotene, biotin for nail and hair health, gamma-linoleic acid from evening primrose oil, octasanol, grapeseed extract, a potent antioxidant important for maintaining capillary strength, and vegetarian digestive enzymes. Visit www.biomedrxsupplements.com.